Let's now move on to some pitfalls that candidates make.
Attire. Over the years, I've accepted students to shadow. I assume that the students would dress appropriately for these clinical experiences. Unfortunately, there were a couple of occasions where students arrived at the hospital in bar attire. Our surgical group is very conservative and values professionalism. My attire, as well as any shadowing students, must reflect our culture of professionalism. Unfortunately, we had to send these students home. In my subsequent communications, I included a description of appropriate attire. Please don't make the same mistake. When in doubt, ask or wear professional attire with comfortable shoes. Tardiness. I've also had students show up late to their clinical experience. Plan accordingly to account for traffic, parking, and the general health center mazes that occur. Aim to arrive at least 15 to 30 minutes before the scheduled meeting time. In good faith, I cannot write a letter of recommendation for a candidate that did not show up on time and prepare to learn. Additionally, I'm typically managing both inpatients and outpatients, and if I'm called back to another care setting, it can result in the student waiting and missing out on opportunities. Syncope. Students commonly experience lightheadedness or pass out at some point in their training. In trauma burn and critical care surgery, we regularly take care of patients who have been struck by tragedy. It's important to be empathetic to these injuries and prevent yourself from cracking your head on the floor requiring a trip to the emergency department. A couple of tips. If you're starting to feel lightheaded, just walk out of the room or go sit down in a populated area. If you feel like you're going to imminently pass out, then just sit on the ground, wherever you are. Everyone will know why, no big deal. Failure to plan. If you're planning on transitioning directly from undergraduate to graduate training, you'll need to start the process early to ensure you've not only met, but exceeded the required hours by the time of application.